Namaskar, I am Dr. Ankur Bahl. I'm a Senior Director in Medical Oncology and Hemato-Oncology at Fortis Memorial Research Institute, Gurgaon and Delhi NCR. So as we all know that World Cancer Day is being held on 4th February of every year. As an oncologist, as a healthcare provider, it's our duty for our patients, caretaker and our fellow colleagues to make them aware that what is the importance of this World Cancer Day, and our aim would be how we can make this world free of cancer. So in this video, in just next 2-3 minutes, I'll be discussing about basically about cancer, symptoms, how to diagnose, and the theme of this year is closing the care gap. So cancer is accumulation of abnormal cells in the body. So these cells get mutated and they get accumulated any of the organ, and that organ we say as breast cancer, esophageal cancer, head and neck cancer, stomach cancer and way forward. So this accumulation of abnormal cells disturbs the anatomy of the organ, and then these abnormal cells spread into other organ which is called as metastatic cancer. So cancer can happen at any age, cancer can happen to any patients. So there are some risk factors for cancer. So these risk factors are being divided into two parts, the modifiable and the non-modifiable parts. The modifiable, which accounts for around 70 to 80% of the cancer, most commonly are related to tobacco in the smoke or smokeless form, alcohol, various viral infections, and the non-modifiable risk factors include the age, the familial history, and certain risk factors like obesity, GERD, and various other factors. So as we all know, in every year we have 1 million deaths related to cancer, and cancer related deaths are usually the second in number worldwide, and every year we get around 8 lakh new patients every year. But the most important part which has to be seen in our part of the world is that majority of the patients come to us at stage 3 and stage 4 cancer. So here we have to break this gap. Here we have to make aware our community, our fellow colleagues, the caretakers, that we have to come early to the center. So majority of our patients are coming late in stage 3 or stage 4. Hence the prognosis and the survivability of these patients are low in our part of the country. So if we close this gap of diagnosis from the patient point and coming to our healthcare provider, then we can win this disease. And the ways to win this disease is that we have to identify, the doctors in the community and the caretakers and the patients have to identify the basic symptoms of cancer, which could be a lump in any part of the body, a weight loss which is not attributed to a dietary or a exercisable exercise thing, a bleeding from any orifice, either from a gynecological organs or from any vomiting or a nasal bleed, a lump in the breast which is progressively increasing, a fever which is not being diagnosed, and a prolonged fever, night sweats. So these are the risk factors, these are the symptoms of cancer which every caretaker or every physician in the community should look after. So once the cancer is being diagnosed, it causes a sense of impending doom in the society. So people take this cancer diagnosis as a death sentence. So we have to break this myth. So closing the gap, which is the theme of cancer from UICC this year. So we have to bridge this gap and we have to narrow down this gap. That is the only way we can win over this disease, and we can have successes when cancer comes. So once the diagnosis of cancer is being made, so it's our duty from a caretaker or from a relative point of view that we have to take this patient to a center which has a comprehensiveness. So a cancer center is called a comprehensive cancer center if there are facilities of medical oncology, surgical oncology, radiation oncology, pain and palliative oncology. There should be an oncodietitian, there should be an oncophysiotherapist, there should be a good blood bank support, and there should be a good nuclear medicine support. So all these supports makes a center a comprehensive cancer center. But yes, we have seen in our part of the country that the gaps comes from lack of awareness in the patient side or the relative side, or even I would not shy to say that in the community care healthcare provider there's a lack of awareness of cancer. how to pick up these cancer patients early, how to screen these cancer patients early, and once the diagnosis is being made, when and how and where to refer these cancer patients so that we can get a good cure rate, we can get a good survival rate. So if we are able to bridge this gap, which this gap could be a awareness gap, gap could be a logistic gap, this gap could be a technology gap. If we are able to bridge this gap and narrow down this gap, so I am certain that in India we can win this disease, and in a decade time or a 15 years time we should celebrate No Cancer Day rather than a World Cancer Day. Thank you.